Hello. So we're here to talk about why homes need to be healthy. I am the facilitator here, so I'll be in the background if there's any questions that come up, or if there's anything, my camera went all blurry, I'm not sure why, but I'll be asking any questions, and if there's any technical issues, we'll try to resolve them. Looks like my camera's blurry, but yeah, so I had asked SLIFNA, Health Authority, to do some presentations. A couple of years ago at our housing conference, we started to have a health perspective related to housing. Again, they agreed to do a presentation on the housing and just the importance of having a healthy home in our communities. We have two presenters here. We have Dr. Lloyd Douglas. Give a wave there, Lloyd. There's Dr. Lloyd. So Dr. Lloyd, and he's currently working at the Sioux First Nations Health Authority, or as a lot of us know in the Northern Ontario region, SLIFNA. And he graduated, since 2019, he's a public health and preventative medical graduate from the Northern School of Medicine. He's also a College and Family Physicians of Canada in 2016. He worked at where I currently work, Independent First Nations Alliance, as a tribal council, and he just currently moved over to SLIFNA. He has been a physician consultant for almost 2 years now, and now his role at the Sioux Lookout is will provide leadership at SLIFNA, provide leadership and technical expertise in the implementation of First Nation-based health and governed public health system for SLIFNA and area communities. And then also with a co-presenter, we have Tricia. I'm going to say her name wrong again, Tricia Flempong, sorry. She also works at SLIFNA, Sioux Lookout First Nations Health Authority. Just give a wave there, Tricia. And then, so she received her master's in public health with specialized in social behavior sciences. She's with the Sioux Lookout First Nations Health Authority and with the approaches to community well-being department, ACW. There's always acronyms all the time. In the public health arm of SLIFNA, Tricia oversees the team that supports evidence-informed decision-making, supports evidence-informed decision-making to ensure programs and services are effective, suitable, and culturally appropriate. Tricia is driven to address the social determinants of health in First Nation communities to improve health inadequacies and advance health well-being. Wow, that's great. So I'm going to turn it over to you guys. I'm not sure how you guys are going to go, who's going to go first, but looking forward to the presentation. Go ahead.
So thank you so much, Jonathan. I'm going to be sharing my screen. Let me get that going. So good afternoon, everyone. I'm Lloyd Douglas, a public health and preventive medicine specialist. I presently work with the Sioux Lookout First Nations Health Authority as a public health physician. And I've been living with my family in Sioux Lookout, Ontario since 2013. It's an honor and a privilege to talk with you today about why homes have to be healthy. I acknowledge that I'm speaking to you from Sioux Lookout, Ontario, which is located on the traditional lands of the First Nations of the Anishinaabe people of Lac Sioux First Nation. I recognize a long history of First Nations peoples in the area, and I acknowledge and wish to show respect to all these First Nations today. I want to thank the organizers of this conference for this opportunity to be here today. And with me, I have Tricia Flempong, and she will introduce herself.
Thank you, Dr. Douglas. Good afternoon, everyone. As Jonathan and Dr. Douglas have already said, my name is Tricia Flempong, and I am also presenting to you from Sioux Lookout in Northwestern Ontario, and it is on the traditional lands of Treaty 3 territory of Lac Sioux First Nation. I do work with the Sioux Lookout First Nations Health Authority, or SLIFNA, and as Jonathan already said, within approaches to community well-being, which is a public health department, and I work alongside with Dr. Douglas. Currently, I am the manager for Roots for Community Wellbeing to support evidence-informed decision-making. And it's a pleasure to be here with you today and sharing our presentation. Thank you. Okay, so we'll just get right into the presentation. And so we do not have any conflicts of interest to disclose. And really the objectives of today's session includes giving an overview of approaches to community well-being, which is a public health department at SLFNA. As Jonathan had said, it's important to incorporate a health lens into housing. And so we would want to be talking about what we're doing here at the Health Authority and what we're about. We will then explore how housing and health are related, given the fact that housing is a key determinant or a key social determinant of health. We will then discuss how housing inequities lead to health inequities, poor quality of life, and decreased well-being. And finally, we will discuss how housing intersects with COVID-19 and the impact it has had on following public health guidance during the pandemic. Next slide, please. Thank you. So as mentioned before, Dr. Douglas and I both work with the Public Health Department at SLFNA, known as Approaches to Community Wellbeing, or ACW. And Jonathan mentioned that we're going to have a couple of acronyms throughout the presentation, so please bear with us. So ACW, or Approaches to Community Wellbeing, is a First Nations governed public health system, and it was established in 2015 based on a 2006 Anishinaabe Health Plan, which details health services within the Sioux region. It was through this plan that public health was identified as a gap in the region. And as a result, the Sioux area chiefs in 2010 mandated SLFNA to develop a regional public health system. And this subsequently resulted in ACW, or Approaches to Community Wellbeing, in 2015. And the goal of ACW really is to improve community well-being through approaches that are sustainable, holistic, integrated, and proactive. And you'll see on your slide the vision, and I'll just read it to you. The Anishinaabe people of this land are on a journey to good health by living healthy lifestyles rooted in our cultural knowledge. It is a unique public health model that fits the needs, the values, the priorities of the First Nation communities, and it can be tailored to each community to best meet its needs, priorities, and resources. Next slide, please. Thank you. So this is the ACW model, and it does look a little bit busy, and I won't get into too much detail, but there are a couple of things that I want to highlight. And so in the middle, you would see all of our values, the themes that guide our work, as well as the different departments. And then the different departments are also in the 4 quadrants of the slide. So we have raising our children at the top left. We have safe communities at the bottom left, healthy living at the top right, and roots for community well-being at the bottom right. And these are all different program areas. However, one program area I would like to highlight is safe communities in the bottom left corner. And safe communities mainly focuses on how communities can be made safer through addressing environmental concerns, preventing injuries, and emergency preparedness. It doesn't focus on housing per se, but it does seek to address issues of housing such as safe drinking water, food safety, mold, bed bugs and other pests, sewage, and air quality. So in partnership with other ACW departments, programs, in conjunction with other ACW departments, programs, advocacy, and policy development are essential aspects of safe communities, in addition to partnerships with technical services at both the tribal council level and the community level. So with this slide, the main thing that I want to bring home is this. When you consider the different ACW program areas, you will observe that suitable housing is a determinant of health that would impact raising our children, because shelter affects family interactions and development of children, which we'll get to later in the presentation. Precarious housing conditions also impact healthy living when we consider things such as respiratory infections. It impacts safe communities, of course, as I mentioned earlier, as well as roots for community well-being and how we support the other programs in the model. Next slide, please. So in this slide, these are some of the values that underpin the work that we do at ACW. I won't go through all of them, but just a couple to highlight include language, history, being holistic, sharing knowledge, and connection to the land.
So let's jump right into it now. So let's start with the definition of healthy housing. The World Health Organization defines healthy housing as shelter that supports a state of complete physical, mental, and social well-being. Healthy housing provides a feeling of home, including a sense of belonging, security, and privacy. Healthy housing also refers to the physical structure of the dwelling and the extent to which it enables physical health, including being structurally sound by providing shelter from the elements and from excess moisture, and by having comfortable temperatures, adequate sanitation and lighting, sufficient space, safe fuel and connection to hydro, and protection from pollutants, injury hazards, mold, and pests. So when we think about healthy housing, this also depends on factors outside its walls. Housing affects the social functioning of families and communities and connectedness to culture. A healthy home is one where people feel safe, comfortable, and enables social interactions that support health and well-being. Finally, healthy housing relies on the immediate housing environment and the extent to which this provides access to services, green space, and active and public transport options, as well as protection from waste, pollution, and the effects of disaster, whether natural or man-made. Now, the Canada Mortgage and Housing Corporation states that acceptable housing is adequate in condition, suitable in size, and affordable. Accordingly, housing is adequate if it does not require any major repairs according to the residents. Housing suitability refers to whether a private household is living in suitable conditions according to the National Occupancy Standard. That is, whether the dwelling has enough bedrooms for the size and composition of the household. To get the thumbs up, a household is deemed to be living in suitable accommodations if its dwelling has enough bedrooms as calculated using the National Occupancy Standard. Now, we have a big problem with crowding and overcrowding in our region. Now, worldwide, crowding is often a marker of poverty and social deprivation. Crowding is considered to be stressful to health and well-being. Household crowding is a condition where the number of occupants exceeds the capacity of the dwelling space available, whether measured as rooms, bedrooms, or floor area, resulting in adverse physical and mental health outcomes. Crowding is as a result of a mismatch between the dwelling and the household. The level of crowding relates to the size and design of the dwelling, including the size of the rooms, and to the type, size, and needs of the household, including any long-term visitors. Whether a household is crowded depends not only on the number of people sharing the dwelling, but on their age, their relationship, and their sex. For example, a dwelling might be considered crowded if two adults share a bedroom, but not crowded if those two adults are in a relationship. Crowding relates to the conditions of the dwelling as well as the space it provides. People may crowd into a particular room or rooms in their home to avoid cold or uninhabitable parts of the dwelling, or to save on heating and other costs. Crowding is considered to be stressful to health and well-being. Now, I'll turn it back to Tricia to talk about the key health risks related to housing.
Great, thank you, Lloyd. So Lloyd did touch on a couple of things pertaining to adverse health outcomes, and there is strong and well-established evidence that various biological, chemical, and physical exposures in the home can have adverse health effects. And according to the World Health Organization Housing and Health Guidelines, it states that improved conditions can save lives, prevent disease, increase quality of life, and reduce poverty. Whereas poor housing conditions are associated with a wide range of health conditions, including respiratory infections, asthma, lead poisoning, injuries, and impacts on mental health. Next slide, thank you. So in particular, poor housing conditions increase the risk of exposure and transmission of infectious and respiratory diseases, including tuberculosis, influenza, and coronavirus, COVID-19, as well as skin diseases. And in 2018, the Sioux First Nations Health Authority produced a health status report. And that report is called the Our Children and Youth Health Report. In this report, it specifically found that skin conditions among children aged 6 to 10 years old are the #1 reason they are brought into the nursing station in communities for medical care. This health outcome is likely impacted by housing conditions. Next slide, please. Thank you. And while we are talking about children, it must be said that research shows their mental health is adversely affected when living in crowded homes, which was something that Lloyd touched on previously. Children are more likely to experience anxiety, stress, depression, and lower levels of development and educational success in overcrowded homes. Again, referring back to the SLFNA Child and Youth Health Report, in 2018, we saw that youth were hospitalized 5 times more than the Ontario youth, and the rate of suicide among the youth was 40 times higher than the Ontario average. We're not saying that housing caused these directly, but we do know that housing does have an effect on mental health. Past persistent housing problems are associated with poor mental health, but we also know that moving out of poor quality housing or removing housing problems helps to improve mental health. Therefore, when it comes to the conversation around mental health programs and policies, it is important to consider housing quality as well. Next slide, please. So within this slide, I want to highlight that structurally deficient housing due to poor construction or poor maintenance, such as plumbing, electricity, drinking water, fire prevention, and inadequate wastewater disposal systems can increase the likelihood that people slip or fall, and thus it increases the risk of unintentional injury. And according to the SLFNA Adult Health Status Report, which was produced in 2019, we found that 71% of emergency department visits were from unintentional injuries. Poor infrastructure, as we just mentioned, increases the risk of injuries from falls or from broken building parts. Further to this, while we're talking about structurally deficient housing, inadequate ventilation is also a key thing to keep in mind. Inadequate ventilation and insulation in homes can contribute to dampness or extremes of indoor temperature, which can encourage mold and dust mites. And we have seen many of these in the homes in First Nations communities. Housing that is difficult or expensive to heat can contribute to respiratory and cardiovascular effects. And finally, the use of unsafe building materials, unsafe building practices, or even building homes in unsafe locations in communities can expose people to a range of risks, including injuries. And at times in communities, construction materials may not meet provincial standards, or they're not suitable for the environment, or they're not constructed according to established building codes. And this can further increase the risk of physical injuries.
So, as you can see, housing inequities lead to health inequities. So, we had stated earlier that housing is a social determinant of health. It is one of the mechanisms through which social and economic inequities translate into health inequities. Upstream policies outside the sphere of health in the area of housing and related areas such as income security and employment play a paramount role in shaping the social and economic context in which people live. Differential access and exposure to social determinants of health, such as housing, can in turn create or worsen health inequities. So for example, if you look at the slide, I have a number of things highlighted there. So poverty, the high cost of housing, and when you combine that with poor quality housing, and inappropriate housing and overcrowding, then you'll get health inequities such as food insecurity, substance use, stress, mental health problems, physical health issues, disabilities, injuries, And the list goes on and on and on. Now, more than a quarter of unreserved First Nations live in crowded homes, a rate that is seven times greater than that of non-Indigenous people. Furthermore, 43% of First Nations houses unreserved are in need of major repairs, compared to 7% of Canadian houses. The poor housing conditions on reserve First Nations are contributing to many health and social problems. Approximately 27% of First Nations people living on reserve were living in crowded conditions in 2011, about 7 times the proportion of non-Indigenous people nationally. Overcrowding, in conjunction with remoteness of communities, has been associated with the increased rates of infectious illnesses. The Standing Committee back in 2015 said this, for example. They reported that unsuitable and inadequate housing resulted in First Nations people dying at a rate 10 times higher than the national average due to house fires. Now, we are in the third wave of this pandemic in our province, and we're going to take a look at what's happening in our region. To date, we have a 144 total cases, and we just looked at a breakdown of the cases recently, and we are seeing how issues with housing, people not being able to isolate properly, how that is driving what we call secondary transmission. That means you have a first case in the house, that person can't isolate, they spread that to everybody else, or most people in the household. And kids are also impacted. Now, I want us to take a quick look at this slide. And on this slide, you're going to see a green line and a red line. The green line is talking about the total cases of COVID in First Nations communities across the country. The red line is everybody else in the country. Earlier on in the pandemic, we were doing well. First Nations were doing well. And all of a sudden, you can see that the rates per 100,000 is higher among First Nations communities than the rest of the country. Now, we believe that the evidence is pointing to overcrowding living conditions and the lack of safe public spaces and spaces to self-isolate is a part, not the entire whole, but is a part of what is driving these high rates of COVID that we're now experiencing among First Nations all across the country. Now, if you look to the guidelines, from your public health unit, the Public Health Agency of Canada, they say to do a number of things. You're going to hear, please wear your mask, please wash your hands, please avoid social, close contact, and you need to social distance and all of these things. And one of the main things they say is that if you think you are exposed to COVID-19, you should go home and you should self-isolate, meaning that isolate at home to prevent spreading illness to others. And they say that the recommended way of doing that is that you need to stay in a separate room, use a separate bathroom from others in your home if it is possible. Now, is this possible? What I am seeing in my region is that this is not necessarily possible. And when you have one case come into a household, pretty soon I guarantee you that you're going to have, in many circumstances, a number of other close household contacts coming down with COVID-19. Now, this was flagged from very early on. In May 2020, the Canadian Centre for Policy Alternatives pointed to this fact. Pretty much they're saying the Public Health Agency of Canada recommends for people to isolate, but how can they isolate when they don't have safe, appropriate, suitable, and adequate housing? This is the reason why you could see we were doing well as First Nations, and then boom, the rates went up. This contributes to that. Now, in our region, our MPP, Sol Mamakwa, in February, he called the Premier Doug Ford for with regards to an emergency, And he said, Premier, you must do everything in your power to ensure that people do not freeze to death in Ibamatong this winter. That's Fort Hope. And that was a press release on March 29, states that the housing crisis in Fort Hope forced 17 people to live in tents. 17 people to live in tents in minus 40 degrees Celsius temperatures. And that resulted in one woman's death from health complications. Saul said, Premier, you cannot isolate from COVID-19 in tents. That's his words. And Ibamatong has far been able to stop. So far, they've been able to stop the spread of the virus in their community in spite of the housing conditions. But this is what some First Nations are dealing with. And this is how inadequate housing, unsuitable housing, this is how it really affects health. Now, going back again as early as March 2020, we had former Chief Munias from Nishkandega saying that overcrowded housing would make self-isolation impossible. Make self-isolation impossible. To that same article, the same CBC article, Minister Mark Miller, Indigenous Services, he talked about the H1N1 experience. He says that he knows that overcrowding poses a real threat to people's health for a number of reasons. And he went on to say, that they have a strategy. But I'm still waiting to see that strategy because I know that it's not a quick fix. We need to fix the housing problem in our communities if we want to fix the health problem in our First Nations communities. So I'll pass it back over to Tricia.
Okay, thank you, Dr. Douglas. And so I'm going to be speaking a little bit about alternate COVID-19 care sites and spending a little bit of time on that because it really does touch on what Dr. Douglas has spoken about with regards to inadequate housing to support COVID-19 prevention measures. So alternate COVID-19 care sites is the encompassing term that refers to COVID-19 assessment, quarantine, and isolation sites. And as Dr. Douglas highlighted, we have seen throughout the pandemic that there is the need to safely quarantine or isolate to reduce COVID-19 transmission risk. And it has been in the news that a number of municipalities within Ontario receive funding for voluntary isolation sites, safe isolation sites, or self-isolation centers. They use different terms, but essentially it's a safe place for people to stay, to safely isolate if they cannot do it at home. And these were often hotels or other buildings that were vacant, so clients can stay in safely. However, given the underlying challenges we highlighted with housing infrastructure in First Nation communities, communities now have to come up with other solutions to address isolation or quarantine needs when it couldn't be done at home. And mind you, there are issues such as overcrowding or living with a vulnerable family member that makes this all the more challenging. Additionally, communities do not have hotels to the same degree as urban centers. As such, many communities resorted to repurposing or retooling existing buildings such as schools, teacherages, community centers, hotels, and even using tents, as Lloyd mentioned earlier, as an alternate COVID-19 care site. And at these sites, of course, care needs to be provided. And since it is in a non-traditional setting, it's important to ensure that these facilities can support the implementation of recommended requirements and infection prevention and control measures. To this end, the SLIFNA COVID-19 Regional Response Team developed a reference document, which you see on your screen. And this document contained technical guidance, recommendations, and minimum requirements for establishing and operating a COVID-19 care site. And so further to this work, it involves visiting communities and inspecting the buildings physically to ensure suitability when it was possible to go into communities, that is. It also involved extensive collaboration and even some trips with the technical services from at the tribal council level. This was very fundamental in the work since technical services carry that expertise in building infrastructure and they're very familiar with the community specific buildings. So while we did all of this, it was great. However, some communities in the region were not able to establish alternate COVID-19 care sites. So they weren't as fortunate as other communities. For communities that did start to establish it, they quickly ran out of resources to maintain and sustain these sites, and then it stopped operating altogether. Other communities had the sites, but because the building was being repurposed, they needed the buildings back to be used for its original purpose. So such as schools and teacherages when they started reopening. So many communities were back to square one. Indigenous Services Canada has supported the retooling or the repurposing of existing structures in some communities, but many communities were still left without adequate facilities. Indigenous Services Canada distributed a limited number of solutions like the Blue Med tent, which you see on my screen, as well as the matrix units. So these are tent-like structures and not anything truly permanent. And there are advantages and disadvantages to each, but we won't really get into the details. I do want to highlight that when we recognize this as a very serious issue within the Sioux region, the SLFNA COVID-19 regional response team within the finance section, in collaboration with tribal councils and NAN, or Anishinaabe Nation, have been continually supporting communities to secure funding to carry out essential services related to COVID-19 prevention and response. The finance team has actively advocated and continues to advocate for communities to ensure that no one is left behind when it comes to suitable isolation infrastructure. To this end, the team worked very closely with Indigenous Services Canada to obtain a limited number of isolation facilities. So this resulted in some communities, but not all, some communities receiving a hard shell facility. So by that, it's referring to a more semi-permanent structure. It's not a tent, it's a bit more sturdier than that. And these can be used long-term in communities to help alleviate some of the housing issues. And this was an approach that we took due to the changing nature of the pandemic and the urgent need for communities. And it really is a small temporary fix. And it's not sufficient to address the larger housing crisis that we see in communities. However, it is one great step forward towards advocating for improved housing conditions, and the pandemic has helped to bring this to light even more.
So, in conclusion, housing is an important social determinant of health. Housing is more than just shelter and includes the social and psychological aspects of the home, the physical structure, its design and characteristics, the immediate physical area around the building, and the social characteristics and range of services in a neighborhood. Housing is also a health equity issue. In addition to overcrowding, a fulsome response should consider quality, safety, and comfort. We know that investing in good quality, suitable, and affordable housing is an investment in health. Let me repeat, when we invest in housing, the bottom line is that we are investing in health. And if we want to protect the health and well-being of our residents beyond COVID-19, we need to think about larger and more permanent solutions. We also need to explicitly embed more solutions informed by public health research and best practice into housing policy. Healthy housing is a broader public health issue, not just an issue during the pandemic. It's time we seriously evaluate the health impacts and invest in affordable housing and new approaches. So, the First Nation infrastructure crisis is more than a building problem or a health problem for COVID-19 transmission and healthcare. We have a colonial systems problem. And that's how we are going to end. When we invest in health, in housing, we invest in health. Thank you.
All right. Let me just check here. I just want to thank you guys for your presentation. Now we're going to go into our question period. And let me just see here. So right now there's no questions, but during your presentation, I have a few questions that I would like to ask you guys. So during the presentation, you guys were talking about the impact of poor housing, and especially on mental health. And it sounds like there's no mental health policy, without considering housing conditions. So how can public health collaborate, like with the First Nation housing departments, how they can collaborate with tribal councils and to advocate for suitable and affordable housing?
So Tricia, I'll let you take that one.
Sure, and you can jump in if you want to add anything. So really, Jonathan, it really centers around collaboration and facilitating and fostering a discussion of health and housing. As well as within public health, one of the things that we tend to do is to provide evidence to support decision making. This is not just evidence from empirical evidence or research. It also includes community perspective, community needs. That is considered evidence as well. So bringing that to the table, bringing the stories that community members have and realizing how it's impacting the health of the communities would really help to spearhead the conversation forward. I think that health should be included in all policies. It should be included in all discussions, but it really starts at building that collaborative network of partners to talk about it and to keep talking about it until momentum is made. When it came to, and I just want to give an example, even with COVID-19 and looking at the alternate COVID-19 care sites and infrastructure, that required focused and intentional discussions with public health and NAN. It involved focused discussions with public health and technical services, which we hadn't done so much in the past before. But being able to talk about it during the pandemic made both parties realize how important it is to include health in housing and housing related issues. And so it really does start from there, intersectoral collaboration, I would say, and being intentional and persistent in those discussions. And Dr. Douglas, if you have anything to add to that, feel free.
Sure, I'd like to jump in. I'd like to kind of like zero in, focus on the mental health component. So for example, you know that, let's say I'm a kid up north and I'm struggling mental health wise. Let's say that I am contemplating, harming and hurting myself. Sometimes we take this very narrow medical approach to it. We tend to look at, let's provide counseling. Let's probably take them out of the community, take them from the home. How often do you hear somebody saying they need a proper house, they need their own room, they need running water in their home? How often do you hear somebody digging deep in the history of that situation and saying this kid is up every single night because there are parties in his home? This kid is up every single night because there are adults who are, messing around. This shouldn't be. We have to really have a complete transformation in the way we look at a mental health or a mental health approach in our region, and understand the contribution that housing is making to that. Someone has to look into that, and that's where public health can help to tease that out a bit. And then working with someone like Jonathan, who is one of the technical services guys, his when he's asking for funding through to the various sources, he can add that component. Here is some evidence to say that if you really want to address suicide in this community, let's build more homes so that we can reduce overcrowding, so that our kids can have a chance at life, just to live and just be kids. To me, it sounds simple. I know it's complicated in terms of all the bureaucracy that's involved in terms of building homes on reserve, the funding, the this, the that. But we will continue to have high rates of mental health conditions in our region until we fix the housing problem. And that's just how I see it, simply put.
Yeah, no, it's true. I mean, there's so many, until you've been just like anywhere else, if you've been in a community or you've seen the conditions, you know, and just with working with professionals in housing or health or education, until you start to see how young people live in some remote conditions, it's, you know, it's a good motivation to get into the communities, and, you know, it's hard. So there's another question, you know, let's get some good discussion. So someone asked, do we have any data directly relating mold exposure to negative health outcomes? So is there any, do we have any data out there that someone's asking that because of moldy homes, what are the health outcomes because of moldy homes?
Thank you so much for that question. And that's something that we would like to follow up on. We'd like to provide you with a literature review of that issue. And Tricia is here. I hope that she's taking notes. There is a clear relation between moldy homes and poor health outcomes. But it's going to be, you know, asthma or other breathing problems. It is clear. Right now, we don't have the exact numbers, but that's something that from a public health perspective, if you have that question, you present that question to us, the team can look in the literature, see what the evidence is saying, then we can get back to a guy like Jonathan and say, how many moldy homes do you have in your, you know, in IFNA, so to speak, or pick one of the IFNA communities in KI or Pikanjicum, how many moldy homes do you have? We can then go back and look at, so from this community with all these moldy homes, we're seeing all these respiratory conditions in kids. I wonder if there's an association. That's what we can do with working public health, working with housing. We can provide some of that data so that when you are, speaking with the powers that be, basically asking for funding for more homes, we can show you that link. And if you look back at the presentation, if you go through, Tricia spoke about the link between injuries and housing based on some of our studies that we're doing, housing and skin infections and so forth. So on. We can make those associations, and that's how we can work together, housing on one side, public health on the other side, to improve housing in the north.
No, that's good. No, it is all about relationships. It's about building on, starting from just understanding what each organization does and what they provide, right? So I just want to thank you guys. You know, I think we're probably past a minute now during our time here. There's always never enough time to get our information out there, but it's a good starting point. I want to thank you, Lloyd, and thank you, Tricia, for your presentation and just for your time. You know, our time, especially in these times of COVID and pandemic, even though we're staying at home, it still seems like there's not enough time in the day to get everything done. So, you know, just from behalf of the working group, from the housing group, we'd like to thank you. And just for your viewers out there, we also have artwork, so a presentation, or no, what's it called? A gift for your presentation that we'll mail to you, and you should get it in 2023. So you can see there's a picture there, because we have no money to pay for postage. So we're just going to see how we can get it to you somehow. But there's Daryl Big George. He's a KI band member, and you're going to get a copy of that for presenting for us. And it'll be in the frame and everything. So is it in the frame? I think it is. Maybe I'm going too far here, but it's not just going to be an email saying thank you. A physical painting.
Physical copy.
And, the listeners out there, don't forget to fill out and score these great individuals on their presentation. There's a survey at the bottom of the thing on the app. Fill out the survey and then sign up for your next presentation at 4:45. and have a nice break. Thank you, guys. Thank you, Dr. Lloyd. Tricia,
Miigwech.
Thank
Thank
you.
listening.
Bye, everyone.
Goodbye.
Bye-bye.